On the People's Project, we've had some excellent guests from the healthcare industry. We've had doctors, we've had specialists, but what we haven't done yet is have frontline health workers. So we thought it was about time we had a chat to someone who works on the front line. And today we have with us Dan, who is a frontline nurse here in one of Melbourne's hospitals and also has qualifications in community health and public health administration. So it is a great pleasure to welcome you to the show, Dan.
Thanks everyone for inviting me. It's my pleasure to be here. Yes.
Fantastic. Dan, the reason why we wanted you to come on is because we're not hearing from the front line what exactly is going on in the hospitals. And from what you have told us previously, it sounds like you have some pretty strong thoughts about the pandemic.
Yeah, so it was my ultimate duty to come here and do my best to express my very big concerns about the current situation, because in my opinion, everything what's happening, not only when it comes to the management of pandemic for general public, but also in healthcare setting and in aged care, is absolutely wrong.
Wrong?
Yeah.
Why is it wrong? I thought we were
What's
trying...
wrong?
Yeah. What's
So
wrong?
my biggest point is that my opinion, in my professional opinion,
Yeah.
so because the way how I've been trained was to always use strongest evidence and facts when it comes to, decision making, provision of care to patients.
Policies,
Yeah,
processes,
exactly,
yeah.
in order to, to adhere to policies and guidelines of any healthcare facilities,
And now?
strictly. Yeah.
And so where are the facts now?
But the facts are, for some reason, this year they're all gone and nobody takes them into any considerations. So that's why it strongly contradicts, in conflicts with my values as a healthcare worker whose duty is to provide safe and appropriate level of care to my patients. So, I've been trained one way, and now it has all been changed. So there is no evidence that pandemic exists. There's no strong evidence and facts. That
What do you mean by that? Because that's a big thing you just said. There's no evidence that a pandemic exists. What are you saying?
Yeah, because the thing is, I don't watch TV.
Right.
But based on what I heard from a lot of people, I have a lot of friends on social network and people that I meet in the street. So they all kept telling me that they heard from some guy on the TV that we all know about, that there is pandemic and that he has evidence and facts,
Yeah.
even though that whenever he was requested to provide such evidence and facts, he refused.
Right.
So that's why, unfortunately, I'm unable to take that for granted. So I always need evidence. And I strongly believe that every healthcare worker, no matter if he's nurse or doctor or radiologist, everyone who deals with provision of healthcare to patients, especially the front line, are required to, actually, it's within their duty, I would say, and pledge to use latest and strongest evidence and facts, in support of whatever they do to patients.
So would you encourage other frontline workers like yourself? Well, actually, I should say a lot of other frontline workers are probably thinking the same way that you are, but don't have the courage to speak up. If you had a message to give to your fellow frontline workers, what would you say to them?
I would tell them that they should not be afraid of speaking out, because I'm not sure what changed this year, because it has always been our, once again, duty, and it's actually in our values to have courage to speak out. Because otherwise, everyone who would have, been entering healthcare setting, through the doors of any hospital, would have been living either very severely handicapped or in a casket. So because it happens so all the time at every given moment. So for example, us as nurses are required to double check all the orders that doctors or anyone else, any seniors that give us. And in most cases, not intentionally, errors occur, and it's our ultimate duty to voice our concerns whenever there's something that's quite not right, and it can pose high risks to health and well-being and safety of our patients, to speak out and even to refuse provision of care, in particular way.
So where's that courage? Where is that kind of trait of a nurse gone in the last 8 months? What's happened with that?
So this is a very big question. So I'm not sure. I think it's a part of the so-called fear mongering, right?
Yeah.
Yeah. So unfortunately, like it's unbelievable. It's not only affecting like the members of general public, but also the healthcare. So the way how I see it as a professional healthcare worker is that it all comes from top to bottom, just down the chain of command, where this fear kind of travels, and it's purely about kicking the bucket of that accountability. Just down the chain, come up until it goes. Yeah, exactly. Because everybody is so scared. Like I strongly believe, like for everyone, it's just absolute nightmare to ever be accused of any accountability, especially when it's related to, outbreak of infection.
You were saying to us earlier that with all the PPE outfits and all the gear that you have to wear when you're dealing with patients, it's kind of affected that ability for you to be able to empathise and have compassion with your patients and make them feel safe. How has it been for you to deal with patients at the moment?
It's extremely difficult. And one of the reasons is because, all those policies that were introduced by the current state government, the way how they were transformed into a healthcare setting, it just, actually in the first place, it was purely unrealistic, for those policies to be implemented in a healthcare setting.
Yes.
It was, there can be many reasons. In my opinion, in my professional opinion, the biggest one is because the healthcare system was not ready for this. Because they introduced all those loads of new requirements, especially in terms of the PPE, but everything else stayed constant. When it comes to the size of facilities, the number of facilities, the number of resources or amount of resources, and the number of staff available. So, it kind of,
So they introduced the policies.
Doesn't work.
They kind of introduced the policies without realising the actual workability of it.
Exactly,
They didn't know what it looked like in real life, That makes sense. Could you imagine if you went to an emergency and you had a mental issue and you were, having having an attack of some sort and no one could touch you because no one could hug you or... that would make it a lot worse. How would you feel, do you think?
I don't think I ever want to be in that situation.
No, I don't want to be in that situation.
Yeah. I mean, but yes, just to add in that, support of the, all those barriers that extra PPE puts to all of us. So it makes it very difficult for us to provide that compassion and care to patients. It kind of creates that artificial barrier, and just makes us really unable to provide professional. Like everybody just becomes sort of like automaton.
Yeah.
Cynical
like
automaton.
Robots.
Yeah. In my opinion, that's not how it should be, because that's not the value. Like it's not in the values of a healthcare professional, especially nurses, because we are required to actually provide compassionate care with empathy, not sympathy, like fake smiles and things like that.
Of course.
So
this isn't why you became a nurse, is it?
Exactly. No. Unfortunately, what happened this year is, I strongly believe that all of us nurses and doctors are not really doing the job that we've been trained for, or that we're trained for. So, we were trained one way to do one job, and this year we are required to do everything
all differently.
Yeah, all differently. So I think it's very not fair to both patients and healthcare providers and nurses and doctors. Yeah.
Dan, do you think your colleagues would feel the same way as you on these matters?
I strongly believe that most of us, if not all, are feeling this way. But unfortunately, because of all that fear...
Even about the pandemic?
Even about pandemic, yeah.
Well, because they're not stupid.
Yeah, because because we are all required to use facts and evidence.
Yes.
Then we're all required to use logic, and I think healthcare workers technically should have ended up unaffected by all those rubbish policies that are completely absurd, enacted by the current state government. And I'm actually very surprised and disappointed that it didn't happen, because I think the healthcare workers actually know the most about it. About viruses, containing pandemic. It's not the job of police or army. Like,
Yeah.
police should do their job. Like, they should protect the innocent from the criminals, not criminals from innocent, and deal with the pandemic. I think is the healthcare workers
Well-
know best because, there've been like always some outbreaks
Yeah.
regarding to gastro or flu
Sure.
or something like
So
that.
you understand
So-
kind of how that works now. Well, Daniel,
Yeah.
maybe you are the first domino to fall over, and maybe after you there'll be hundreds of nurses lining out outside our studio. What do you reckon?
Well, if you're correct and other frontline workers think the same as you, then your message is very powerful that they should speak out if they have a story to tell. I think
It's just it's our duty to speak out.
Well, thank you so much, Daniel, for doing that. We really appreciate you coming on the show. And a lot of nurses are scared to speak out. A lot of business owners are scared to speak out. But I think that the value of what you're doing far outweighs the risk of you speaking out. So I thank you very much for coming on the show.
My pleasure.
Daniel, thank you.
My pleasure.
And good luck.
Thank you. We all need it.